Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education, and today we are going to talk about acne. Let's understand what is acne, why do breakouts happen, what are whiteheads, what are blackheads, why do they bother you, what are the theories. There are so many myths about what causes acne. Some people blame their food for the outbreak, some think that dirty skin causes it, but there is very little evidence that either of these have much effect on most people's acne. People of every single race, all ages get acne. 4 out of 5 people between the age of 11 and 30 have outbreaks at some point. It is the most common problem in adolescents and young adults. Although acne is usually not a serious threat, it can be very upsetting, and severe acne can lead to permanent scarring of your face. But fortunately for most people, acne goes away by the time they reach their 30s. So let's try and understand the background of acne today.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Most of you might know that acne begins in the skin's oil gland. There is an oil gland inside the skin wherefrom the oil travels up to the hair canal. The canal which is called a follicle, which also contains the hair. So this oil basically empties into the skin surface through this hair canal, through this follicle. This opening into the skin is called a pore, and the hair oil and the cells which line this narrow opening, narrow pore, can sometime plug the pore and therefore block it. When this happens, the further oil which is being produced inside through the oil glands will not be able to reach the skin and will get collected inside the pore. And this mixture of oil and cells allows the bacteria which normally live in your skin to grow inside the plugged follicle. And when they grow, when they proliferate, when they grow, your body defense system attacks these bacteria, and because of this defense mechanism, that area gets inflamed. This inflammation leads to the redness and the issues. Now, there are some stages here. If the plugged follicle stays beneath the skin, you get a white bump. It is called as a whitehead. If this plugged follicle, if that oil reaches the surface of the skin and opens up, then you get a blackhead. Now, blackhead is not because of any dirt. This is because the oil, which when comes in contact with air on the surface of the skin, becomes black. Both these whiteheads and blackheads may stay in your skin for a long time. Eventually what happens, the walls of the plugged follicle, the covering, the cap, breaks down, leading to a pimple or zits. It's also called as zits or a pimple or an acne. So this is how an acne occurs. One important factor in acne is an increase in certain hormones during puberty, and these hormones cause the oil glands in your skin to enlarge and make more oil. These hormonal changes are also related to pregnancy or sometimes while starting or stopping birth control pills. So hormonal changes can lead to acne, and therefore acne are sometimes treated with contraceptive pills, hormonal replacement therapies. Then some studies suggest that you can actually inherit a tendency to develop acne from your parents. So genetics is likely to play some role. Okay, now let's talk about stress. Stress does not cause acne. Mind well, stress does not cause acne, but research has found that for some people who already have acne, stress can make it worse. So that happens. Then there are certain drugs, certain medicines which are known to cause acne. There are certain cosmetics, greasy cosmetics, which for example can alter the cells of the follicles and make them stick together, producing a plug. And even the microbiome present on your skin, in your gut, they also play a role whether or not you'll have acne or not. So if you do have acne, a few tips here, then that first of all, you need to try all oil-free cosmetics. Choose products which are labeled non-comedogenic, meaning that they do not produce, they do not promote the formation of closed pores. If you have acne, don't rub or touch your pimple. Squeezing, pinching, pricking or pricking the pimple can lead to scars or dark blotches, and these scars are very difficult to treat. Just gently wash your face with a mild cleanser twice a day, and again if you exercise, heavy exercise, after every heavy exercise. Do not use strong soaps or very rough scrub pads. They don't help, they make the problem worse. It's also important to shampoo your hairs regularly. Especially if you have oily hairs, you may want to wash your hairs every day. Then several over-the-counter medications are available to treat mild to moderate acne. And remember, it may take 6 to 8 weeks before you even notice an improvement. For more severe cases of acne, you need to talk to your doctor for your options. Researchers are trying to work on developing a new drug, new treatment to treat acne, and we are also trying to better understand the cause of acne so that we can explore new remedies. In the meantime, several available treatments are there which may help you. There is a known regime which actually proves, which has proven in research that if you do this regime, 3-step regime, skincare regime on a daily basis for several weeks, then you get much better results with any other regime. And I will not talk about any single product here, it's a concept. So the concept is to use a mild cleanser, a toner, and any over-the-counter anti-acne medication. So you need to use a cleanser on your face, then a toner, and then an anti-acne medication twice a day, and then again whenever you do a heavy exercise daily. That's the best regime. So that's all about acne, guys, on a brief level. So for more such videos, don't forget to browse onto my channel. There are so many videos available on various healthcare topics. All the information given here is not an opinion of a single doctor. These videos, these data, this information is directly referenced from the internationally accepted US National Medical Library, so you can definitely trust this information. Those who don't know me, I am Dr. Paramjeet, a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Ghaziabad, Delhi NCR, and this is my channel, Dr.Education. So don't forget to subscribe and hit the bell icon. Till next time, stay connected, stay healthy.